The waiting room was packed that night, every seat taken, people standing against walls, some sitting on the floor. Little Alex held onto his mom's hand, his face flushed with fever. Sweat beaded on his forehead as he leaned against her, barely able to stand. "Just hang in there, buddy," Lisa whispered, brushing his dark hair back. "They'll call us soon." They'd been waiting for 3 hours already. Alex's fever had spiked suddenly that afternoon, climbing to 103 degrees despite the medicine she'd given him. When he started complaining that his neck hurt and couldn't bear to look at bright lights, Lisa knew they needed to get to the hospital. At the front desk, Nurse Diane glanced at them occasionally, her lips pressed into a thin line. She'd been working double shifts all week and the emergency room was understaffed as usual. Another Friday night, another packed waiting area. "Mom, I don't feel good," Alex mumbled, his voice barely audible. "I know, sweetie. Just a little longer." When Alex's legs buckled, Lisa caught him before he hit the floor. "Please," she called out. "My son needs help now." A few heads turned, but most people kept staring at their phones or the muted TV mounted in the corner. They were all waiting too. Nurse Diane huffed as she approached. "Ma'am, everyone here is waiting for their turn. We're doing the best we can." "He's burning up. He can't even stand anymore." Diane checked Alex's wristband from when they'd registered. "We have his information. We'll call when it's his turn. But he could have meningitis. His neck is stiff, he can't handle bright light, and his fever—" "Ma'am," Diane cut her off. "I understand you're concerned, but I have procedures to follow. There are people here with chest pains and breathing problems." Just then, Alex vomited on the floor. Other patients moved away quickly. Diane's expression hardened. "Now look what's happened. We'll have to get that cleaned up." "Please," Lisa begged, tears forming. "Just check him. Take his temperature at least." A young doctor passing through the waiting area noticed the commotion. Dr. Rivera had just finished his residency last month and was still learning the hospital's rhythms. He approached them, kneeling beside Alex. "How long has he been like this?" he asked, putting a hand on Alex's forehead. "The fever started yesterday, but it got really bad this afternoon. Now he can't look at lights and his neck." Dr. Rivera gently felt the back of Alex's neck, noting how the boy winced when he tried to move it. "Let's get him back right now," he said, looking up at Diane. "I want a full workup." "Doctor, we have patients who've been waiting longer and there are protocols. This looks like meningitis. We need to move now." His voice was firm but calm. Diane's face flushed. "There are no beds available right now. We're at capacity." "Then make room," Dr. Rivera said, already lifting Alex into his arms. "Call upstairs and tell them we need emergency lumbar puncture equipment ready, and get IV antibiotics started immediately." They rushed through the double doors, leaving Diane standing in the waiting room. Lisa felt the first wave of relief. Someone was finally listening. In the treatment area, nurses sprang into action. They placed Alex on a gurney, started an IV, drew blood, and prepared for the spinal tap that would confirm whether he had meningitis. "We're going to take good care of him," Dr. Rivera assured Lisa. "You got him here in time." While the medical team worked, Diane entered the treatment area, her expression tense. She'd been a nurse for 15 years and didn't appreciate being overruled, especially by a new doctor. But when she saw how quickly Alex's condition was deteriorating, something shifted in her perspective. "Doctor," she said quietly, "the lab is ready for the samples. I've also contacted the pediatric ICU to prepare for possible admission." Dr. Rivera nodded. "Thank you, Diane." The spinal tap confirmed their fears. Bacterial meningitis. Within 30 minutes of being taken back, Alex was receiving powerful antibiotics that would save his life. Later that night, when Alex was stabilized and transferred to the pediatric intensive care unit, Diane found Lisa in the hallway staring out the window at the city lights. "Your son is going to be okay," Diane said, standing beside her. Dr. Rivera caught it in time. Lisa nodded too, exhausted to speak. "I owe you an apology," Diane continued. "I should have listened to you. I've been so focused on following protocols that I missed what was right in front of me." "You're overworked," Lisa said softly. Everyone here is. That's no excuse, not when it comes to a child's life. They stood in silence for a moment, watching the lights of ambulances arriving below. You know, Diane finally said, I became a nurse because I wanted to help people. Somewhere along the way I started seeing patients as cases to process rather than people who need care. It's hard to stay compassionate when you're surrounded by suffering every day, Lisa offered. Diane thought about this. Maybe. But that's exactly when compassion matters most. The next morning, Dr. Rivera found Diane reviewing triage protocols at the nurses' station. How's your shift going? He asked. I'm proposing changes to our assessment procedures, she replied. We need better screening for serious infections, especially in children. Dr. Rivera smiled. The hospital administrator won't like changing the system. Then I'll keep pushing until they do. Diane looked up from her papers. Sometimes it takes a wake-up call to remember why we do this job. Upstairs, Alex was already showing signs of improvement. The antibiotics were working, and though recovery would take time, he would make it through without lasting damage. Lisa sat beside his bed, holding his hand as he slept. Outside the window, the sun was rising, painting the sky in shades of pink and gold. A new day was beginning, bringing with it the promise of healing, not just for Alex, but perhaps for a system that sometimes forgot to see the human beings behind the symptoms. And in the emergency room below, Nurse Diane greeted a new patient with different eyes, remembering that behind every complaint, every fever, every worried face was a person with a story that deserved to be heard. 2 weeks after Alex's hospitalization, Diane sat in the hospital cafeteria, pushing salad around her plate. The fluorescent lights buzzed overhead as she reviewed her notes for the staff meeting. Mind if I join you? She looked up to see Dr. Rivera holding a tray with a sandwich and coffee. Please, she said, sliding her papers aside. He settled across from her. How's the protocol revision coming along? Slowly. Administration wants data showing we're missing critical cases before they'll approve changes. Dr. Rivera nodded. I might be able to help with that. I've been pulling records from the past year. Diane smiled gratefully. Since the night with Alex, she and Dr. Rivera had formed an unexpected alliance. His fresh perspective combined with her years of experience created something powerful when they weren't butting heads. Have you heard how Alex is doing? Doctor Rivera asked between bites of his sandwich. Lisa brought him by yesterday for a follow-up. He's doing great, back to being a normal 8-year-old. Diane paused. She brought us cookies. Can you believe that? After what happened? People can be surprisingly forgiving when they see you're trying to make things right. Their conversation was interrupted by a code blue announcement. Both abandoned their lunches and rushed toward the emergency department. They arrived to find chaos. A construction worker had fallen 3 stories and was being wheeled in, his body bloodied and broken. The trauma team swarmed around him, calling out vital signs and injuries. BP dropping 80-40. Multiple fractures, possible internal bleeding. We need an OR now. Dr. Chen, the trauma surgeon, barked orders as they rushed the patient toward the elevator. Who's coming up with me? I'll assist, Dr. Rivera volunteered. Diane returned to the emergency room, which was still reeling from the trauma case. As she helped restore order, she noticed a woman sitting alone in the corner, trembling. Ma'am, are you all right? Diane approached her. The woman looked up with tear-streaked cheeks. That was my husband, Tom. We've been married for 30 years. Her voice broke. He forgot his lunch this morning, so I brought it to the construction site. I saw him fall. Diane sat beside her and took her hand. I'm Nurse Diane. What's your name? Helen. Helen, the trauma team here is excellent. Dr. Chen is one of the best surgeons in the state, and Dr. Rivera, who went with them, is incredibly thorough. Helen nodded, but her eyes remained distant. Would you like some water or coffee? No, thank you. I just need to know he'll be okay. Diane stayed with Helen, walking her to the surgical waiting area and making sure she called family members. When her shift ended 2 hours later, Diane clocked out but didn't leave. Instead, she checked on Helen, who was now surrounded by adult children and a sister. "Any news?" Diane asked. "Still in surgery," Helen said. "Thank you for staying. That's what we're here for." It was nearly midnight when Diane finally left the hospital. The next morning, she arrived early and immediately checked Tom's status. He had survived the surgery but remained in critical condition. Throughout the week, Diane stopped by the ICU during breaks to check on Tom and chat with Helen. She brought extra blankets when Helen insisted on staying overnight and made sure she ate. Other nurses noticed the special attention. "You've changed," commented Nancy, a fellow ER nurse. "A month ago you would have said we can't get personally involved with every patient's family." Diane considered this. "I was wrong. Getting personally involved is exactly what this job is about." On Friday, Dr. Rivera joined Diane on her visit to Tom's room. Helen's face brightened when she saw them. "His numbers are better today," she told them. "The doctor says he might wake up soon." "That's excellent news," Dr. Rivera said, reviewing the chart. As they left the ICU, Dr. Rivera turned to Diane. "You've been spending a lot of time with them. Helen reminds me of my mom. Strong, but not used to asking for help." They paused at the window overlooking the hospital entrance. "You know," Dr. Rivera said, "when I was in medical school, one of my professors said something I'll never forget. He said medicine is a science, but healthcare is a relationship." Diane smiled. Your professor was a wise person. That night, as Diane was preparing to leave, her phone rang. It was Helen. "He's awake," Helen said, her voice thick with emotion. "He asked for a hamburger." Diane laughed. "That's a good sign. Can you come? He wants to thank you." 20 minutes later, Diane stood in Tom's room. His face was bruised and tubes seemed to emerge from everywhere, but his eyes were alert. "You're the angel my wife keeps talking about," he said, his voice raspy. "I'm just a nurse doing my job." "No," Helen interrupted. "You did much more than your job." As Diane drove home that night, she thought about how different things felt now compared to a month ago. She had been going through the motions then, burned out and disconnected. Now, each day felt purposeful again. The next morning, Diane arrived at work to find Dr. Rivera waiting with a thick folder. "I've got the data for our protocol proposal," he said. "And something else. The hospital board is forming a patient advocacy committee. I recommended you as the nursing representative." Diane stared at him in surprise. "Me? After what happened with Alex?" "Especially because of what happened with Alex. You recognized a problem, and instead of making excuses, you decided to fix it. That's exactly who should be on this committee." Before she could respond, their pagers went off simultaneously. Multi-vehicle accident on the highway. Multiple casualties inbound. As they hurried toward the ambulance bay, Diane felt a strange sense of calm. The old anxiety was replaced by focused determination. This was where she belonged. The first ambulance screeched to a halt. Paramedics rushed out with a stretcher carrying a teenage girl, her neck stabilized in a collar. 16-year-old female, possible spinal injury, was responsive at the scene, but lost consciousness en route, the paramedic reported. Diane moved alongside the stretcher, already checking vital signs. "Trauma Bay 1 is ready. Family?" Parents were in the car behind her. "They're coming in the next ambulance." Dr. Rivera joined them, calling out orders as they transferred the girl to the trauma bay. More ambulances arrived, bringing more patients, more stories, more lives hanging in the balance. Hours passed in a blur of activity. At some point, Diane found herself comforting the teenage girl's parents, explaining procedures and what to expect. She saw their terror transform into cautious hope when she took the time to really listen to their questions. By evening, when things finally calmed down, Diane found Dr. Rivera updating charts at the nurse's station. 5 critical patients, all stabilized, he said without looking up. "Not bad for a day's work?" Diane leaned against the counter. "I'll take that committee position." Now he looked up, smiling. "I thought you might." But I have conditions. I want to implement regular empathy training for all staff, and I want to create a better system for identifying when patients in the waiting room are deteriorating. You don't ask for much, do you? But he was still smiling. Go big or go home, right? Diane glanced at the waiting room through the glass doors. It was full again, as it always was, but instead of seeing problems or burdens, she saw people with stories, each deserving of care and attention. You know what's funny? She said quietly. A month ago, I was thinking about quitting nursing altogether. What changed? She thought about Alex's pale face, about Helen's grateful eyes, about the teenage girl who would walk again because they had acted quickly. I remembered why I started, she said simply, and I found a better way to continue. 3 months after the formation of the Patient Advocacy Committee, Diane stood in front of the hospital board, pointer in hand. Behind her, a screen displayed charts and statistics. As you can see, she explained, since implementing our new triage protocols, critical case identification has improved by 32%. Average wait times for all patients have decreased by 45 minutes, and patient satisfaction scores are up across all departments. The board members exchanged impressed glances. The hospital administrator, Dr. Wilson, leaned forward. These are remarkable improvements, Nurse Diane. What do you attribute them to? Listening, she said simply. We started listening to patients and to each other. After the meeting, Dr. Rivera caught up with her in the hallway. That was impressive. Even Dr. Wilson was taking notes. Diane laughed. I never thought I'd see the day. There's something else, Dr. Rivera said, his expression turning serious. The pediatric unit has requested your help implementing similar changes. Me? I don't have pediatric experience. They don't need your medical expertise. They need your approach to patient care. As they walked toward the cafeteria, Diane felt a strange mix of pride and humility. 6 months ago, she had been just another burned-out nurse going through the motions. Now her colleagues were looking to her for guidance. In the cafeteria line, a familiar voice called out, Nurse Diane. She turned to see Lisa and Alex approaching, the boy bouncing with energy. His cheeks were rosy with health, nothing like the feverish flush from that night in the ER. We were just upstairs for his final follow-up, Lisa explained. Dr. Singh says he's completely recovered. That's wonderful news, Diane said, genuinely delighted. Alex looked up at her. Mom says you helped save my life. Diane glanced at Lisa, who nodded encouragingly. Actually, Diane said, kneeling to Alex's level, your mom saved your life by knowing something was wrong and not giving up until someone listened. I just learned an important lesson that night. What lesson? Alex asked. That sometimes the most important thing we can do is stop and really listen. Alex considered this with the seriousness only an 8-year-old can muster. Like when Mom tells me to clean my room, the adults laughed and Lisa ruffled his hair. Exactly like that. After they said goodbye, Dr. Rivera shook his head in amazement. Hard to believe that's the same kid who was at death's door. Children are resilient, Diane said, watching them walk away. Adults too, sometimes. That evening, Diane led her first training session for the pediatric department. Nurses, doctors, and support staff filled the conference room, some curious, others skeptical. I'm not here to tell you how to do your jobs, she began. You're all excellent at what you do. I'm here to talk about how we can build better bridges between our expertise and our patients' experiences. A veteran pediatric nurse named Gloria raised her hand. With all due respect, we're already understaffed and overworked. We don't have time for more procedures. Diane nodded. I understand that concern. But what we've found is that taking the time to truly listen actually saves time in the long run. Patients who feel heard are more cooperative, provide better information, and trust our treatment plans more readily. By the end of the session, even Gloria was taking notes. As people filed out, she approached Diane. You've given me something to think about, Gloria admitted. After 30 years of nursing, that's not easy to do. Diane smiled. 30 years? I'd love to hear some of your stories sometime. Be careful what you wish for, Gloria warned with a wink. I've got enough stories to fill a book. Over the next few weeks, Diane divided her time between ER duties and helping implement changes in the pediatric ward. She and Gloria became unlikely friends, exchanging ideas and experiences. One rainy Tuesday, they shared lunch in the staff room. "You know what's funny?" Gloria said between bites of her sandwich. "I used to think compassion fatigue was inevitable in this job, like it was a badge of honor to become a little hardened." "I felt the same way," Diane admitted. "I thought maintaining professional distance meant keeping emotional distance." "What changed your mind?" Diane considered the question. "I realized that distancing myself from patient suffering wasn't making me a better nurse. It was making me a worse one." Gloria nodded thoughtfully. "Yesterday I had a mom bring in her third kid this month for what turned out to be just a cold. Before your training I would have been annoyed. Instead, I asked why she was so worried. And? Turns out her sister lost a child to a rare complication of a respiratory infection last year. She's terrified the same thing will happen to her kids." Gloria shook her head. 5 minutes of conversation completely changed how I saw the situation. Their lunch was interrupted by an announcement over the PA system. "Code Blue, Pediatric Unit. Code Blue, Pediatric Unit." Both women abandoned their food and rushed to the elevator. When they arrived, they found the team working frantically on a small boy, perhaps 4 years old. Dr. Rivera was performing chest compressions while a pediatric doctor prepared medications. "What happened?" Diane asked a nearby nurse. "Post-op tonsillectomy. He was fine 1 minute, then his airway closed up. Possible allergic reaction." Gloria immediately went to the parents, who stood frozen in horror near the door. She guided them to a small consultation room nearby, speaking softly. Diane joined the resuscitation efforts, assisting with medications and monitoring. After 10 agonizing minutes, the boy's heart rate stabilized and his oxygen levels began to rise. "We've got him back," Dr. Rivera announced, his scrubs soaked with sweat. "Let's get him to the PICU." As they transferred the boy to intensive care, Diane saw Gloria still with the parents, holding their hands, explaining everything. Later, when things had calmed down, Gloria found Diane charting at the nurse's station. "The parents asked if you could stop by," she said. "They want to thank the whole team." Diane looked up in surprise. "They want to thank us? Their son nearly died in our care." "Yes, but they said everyone worked together so seamlessly. They felt like their son was the only patient that mattered in that moment." Diane followed Gloria to the PICU, where the boy was now stable, breathing with the help of a ventilator. His parents stood at his bedside, exhausted but relieved. "This is Nurse Diane," Gloria introduced. She was part of the team that helped save Tyler. The father stepped forward and shook Diane's hand. "Thank you," he said simply, his voice thick with emotion. "I'm just glad we could be there when you needed us," Diane replied. The mother looked up from her son's bedside. "The doctors explained what happened. They think it was an allergic reaction to one of the medications. Tyler has severe allergies," the father added. "We told everyone who would listen before the surgery." Diane felt a familiar discomfort. This was potentially a case where crucial information had been overlooked. "Would you mind if I look into how that information was documented?" she asked carefully. "Not to place blame, but to make sure this doesn't happen to another child." The parents agreed, and after spending a few more minutes with them, Diane and Gloria left. "You're thinking protocol failure?" Gloria asked as they walked back to the nurse's station. "Maybe. Or communication failure. Either way, we need to find the gap." They spent the next hour reviewing Tyler's chart. Sure enough, his allergies were documented in 3 different places, but the specific medication that triggered his reaction had been administered anyway. "Look at this," Gloria pointed to the electronic record. "The allergy warning pops up, but it requires an extra click to see the full list. Someone only checked the first screen." Diane sighed. A design flaw in the system. One that nearly cost a child his life. That evening, Diane stayed late drafting a proposal for changes to the electronic medical record system. As she worked, Dr. Rivera brought her a cup of coffee. "You know, most people would be headed home by now," he commented, pulling up a chair. Most people didn't watch a preventable code blue today. He nodded, understanding. I spoke with the software team. They can implement the changes you're suggesting, but it will take time. In the meantime? In the meantime, we go back to basics. Verbal confirmation of allergies at every handoff. Old school but effective. Diane smiled tiredly. Sometimes the old ways are the best ways. As they sat in comfortable silence, Diane reflected on how much had changed. The hospital still faced the same challenges. Understaffing, limited resources, complex cases, but something fundamental had shifted in how they approached these problems. You know what I realized today? She said finally. What's that? We're not just changing procedures, we're changing the culture. Dr. Rivera smiled. And that, Nurse Diane, is much harder and much more important. As if to punctuate his point, Gloria appeared in the doorway, a new chart in hand and determination in her eyes. We've got a complicated case coming in, she announced. And I think we need your perspective. Diane stood, setting aside her coffee. This was the job she had chosen, the calling she had rediscovered. Not always easy, rarely perfect, but always, always worth doing right. 8 months after the changes began, Diane stood in the hospital auditorium, watching as staff from every department filed in for the quarterly meeting. Dr. Wilson, the hospital administrator, had asked her to present their progress to the entire staff. Nervous? Dr. Rivera appeared beside her, straightening his tie. A little, she admitted. It's one thing to talk to the board, another to face all my colleagues. You've earned their respect, Diane. They want to hear what you have to say. As the lights dimmed and Dr. Wilson introduced her, Diane took a deep breath and stepped onto the stage. The faces looking back at her belonged to people she'd worked alongside for years. Some she'd argued with, others she barely knew. 6 months ago, she began. We started a conversation about what it means to provide true care. Not just medical treatment, but actual care for the whole person who comes through our doors. She clicked through slides showing their improvements in patient outcomes, staff satisfaction, and even cost effectiveness. But numbers don't tell the whole story, she continued. The real change is happening in moments that don't get recorded in any chart. She shared stories with permission of patients whose experiences had been transformed by the new approaches. The elderly man whose confusion had been mistaken for dementia until a nurse took time to realize he was just having medication side effects. The teenage girl whose vague complaints turned out to be signs of domestic abuse, discovered only because someone asked the right questions and really listened to the answers. We all went into healthcare for a reason, Diane said, looking around the room. Sometimes in the daily grind we forget that reason. These changes aren't about adding more work to your already full plates. They're about remembering why we wanted those plates in the first place. When she finished, the applause was immediate and genuine. As people came up to share their own stories afterward, Diane felt a tap on her shoulder. You've got a visitor, Gloria said, gesturing toward the back of the room. There stood Tom, the construction worker who had fallen months ago. He walked with a cane now, but he was walking, something the doctors hadn't been sure would happen. Tom, Diane hurried over. What are you doing here? Had my final checkup with orthopedics, he explained, leaning on his cane. Heard there was some big meeting where they were talking about you, so I thought I'd stop by. About the changes we've been making, Diane corrected. Not about me specifically. Helen, standing beside her husband, shook her head. From what we heard, you're the heart behind those changes. Tom nodded in agreement. Wanted to see it for myself. Also wanted to tell you something. What's that? I'm going back to work next month. Diane's eyes widened. Back to construction? After what happened? Not up on the scaffolding. He chuckled. They're making me a site supervisor. Desk job mostly, but I'll be working. That's wonderful news, Tom. Wouldn't be here without this place, he said, gesturing around the hospital. Without people like you. After they left, Dr. Rivera found Diane standing by the windows, looking thoughtful. Good presentation, he said. Thanks. She turned to face him. Tom's going back to work. I heard. Amazing recovery. It makes it all worth it, doesn't it? Days like today. Dr. Rivera leaned against the window frame. Days like today help, but the hard days are important too. Diane nodded, understanding what he meant. The changes they'd implemented hadn't eliminated the difficult realities of healthcare, the patients they couldn't save, the limits of medicine, the emotional toll of the work. But they had created a system that acknowledged those difficulties. Instead of ignoring them, their conversation was interrupted by their pagers going off simultaneously. Emergency department, all available staff. When they arrived downstairs, they found organized chaos. A school bus had overturned on the highway, and injured children were arriving by ambulance. Diane, we need you coordinating triage. The charge, nurse called out. Dr. Rivera, Bay 3 has a head injury. For the next several hours, the emergency department operated like a well-rehearsed orchestra. Nurses and doctors moved efficiently between patients, communicating clearly, making quick but thorough assessments. In one corner, Diane noticed a young nurse named Zoe talking to a terrified little girl while cleaning a cut on her forehead. The nurse had knelt down to the child's eye level, speaking softly. I'm just going to clean this up so we can see it better, Zoe was saying. It might sting a little, but you can squeeze my hand if it hurts, okay? The girl nodded bravely. Can you tell me about your favorite animal while I work? Zoe asked. As the girl launched into a description of her pet rabbit, the nurse skillfully cleaned and assessed the wound. No tears, no struggle, just a connection between caregiver and patient. Later, when the crisis had passed and all the children were either treated and released or admitted for observation, Diane found Zoe in the break room. That was good work today, she said, pouring herself a cup of coffee. Especially with the little girl with the head laceration. Zoe looked up in surprise. Oh, thanks. I was just doing what you taught in the workshop last month, about meeting patients where they are. Diane smiled, realizing she had just witnessed her own teachings being put into practice by the next generation of nurses. That evening, as she was preparing to leave, Dr. Wilson stopped her in the hallway. Diane, do you have a moment? Of course. She followed him to his office, wondering what he wanted to discuss. Once inside, he didn't sit behind his desk as usual, but took a chair across from her instead. I wanted to talk to you about expanding the program. Expanding? Other hospitals in our network have noticed our improvements. They want to implement similar changes. Diane stared at him. That's wonderful news. It is. And they want you to help them do it. Me? But I have responsibilities here. Dr. Wilson nodded. You do, but I think we could arrange for you to split your time. 3 days here, 2 days consulting with other facilities. With appropriate compensation, of course. Diane felt overwhelmed. I never expected anything like this. Neither did I, frankly, Dr. Wilson admitted with a small smile. When you first proposed these changes, I thought they were idealistic and impractical. I was wrong. As she left his office, Diane found herself walking through the emergency department one more time. The evening shift was well underway. The rhythm different, but the purpose the same. At the nurse's station, she paused to watch the interactions. A physician discussing a case with a nurse, both engaged and respectful. A registration clerk escorting an elderly patient to a chair instead of just pointing. Small moments of humanity amidst the clinical work. You looking for something? Gloria appeared beside her, chart in hand. Just observing, Diane replied. Dr. Wilson offered me a consulting position to help other hospitals implement our changes. Gloria's eyebrows shot up. Well, moving up in the world. I haven't decided yet. It would mean less time here. The foundations are solid now, Gloria said. Maybe it's time to spread the gospel. Diane laughed. It's hardly a gospel, isn't it? The good news that healthcare can be both efficient and compassionate sounds pretty revolutionary to me. As they stood there, the ambulance bay doors slid open. Paramedics wheeled in a new patient, an older man clutching his chest. Without hesitation, both women moved toward the incoming stretcher, ready to receive the patient, ready to provide care in its fullest sense. Tell me about him. Diane said. To the paramedic. Walter Fisher, 67. Chest pain started about an hour ago while he was gardening. No prior cardiac history, but his father died of a heart attack at 70. As they transferred Walter to a bed, Diane noticed his frightened eyes. Mr. Fisher, I'm Nurse Diane. We're going to take good care of you. He nodded, still clutching his chest. On a scale of 1 to 10, how's your pain right now? 7, he gasped, as the team worked around him, connecting monitors and starting. An IV, Diane kept one hand on his shoulder, a point of human contact amidst the necessary clinical interventions. My wife, Walter managed to say. She doesn't know. We'll call her, Diane assured him. What's her name and number? A small thing, making that connection for him. But in that moment, as fear clouded his eyes, it meant everything. This, Diane thought as she dialed the number Walter provided, is what it's all about. Not the protocols or the statistics or the presentations, important as they were. This moment of being truly present for another human being in crisis. Maybe that was the message she needed to carry to other hospitals. Maybe that was what healthcare, at its core, was always meant to be. 1 year to the day after Alex had been rushed into the emergency room with meningitis, Diane stood in the hospital lobby watching a small crowd gather. Today was the official unveiling of the new patient care initiative that would be implemented across all 5 hospitals in their healthcare system. Ready for your big moment? Dr. Rivera asked, appearing beside her. As ready as I'll ever be, she replied, smoothing her blazer, though I still think you or Dr. Wilson should be the one cutting the ribbon. Not a chance. This is your baby. The past year had been a whirlwind. After accepting the consulting position, Diane had split her time between hands-on nursing and helping other facilities implement the changes that had transformed their hospital. There had been resistance, of course, budget concerns, skepticism, the natural human reluctance to change established patterns. But the results spoke for themselves. Dr. Wilson stepped up to the podium, tapping the microphone. If I could have everyone's attention, please. The crowd quieted, a mix of hospital staff, board members, community representatives, and even some former patients. 1 year ago, Dr. Wilson began. This hospital embarked on what some considered an idealistic experiment. Could we change not just our procedures, but our entire approach to patient care? Could we create a system that honors both medical expertise and human connection? Could we build something better without additional budget or staff? He paused, looking around the room. The answer, as it turns out, is yes. Our patient satisfaction scores have risen to the top percentile nationally. Our staff retention has improved by 40%. And most importantly, our patient outcomes, the actual health results that matter most, have shown significant improvement across all departments. A smattering of applause broke out. None of this would have been possible without the vision and persistence of one individual. Dr. Wilson gestured toward Diane, a nurse who had the courage to speak up after a near miss with a young patient, and the wisdom to turn that moment into meaningful change. Nurse Diane, would you please join me? As Diane walked to the podium, she spotted familiar faces in the crowd. Lisa and Alex, now healthy and energetic. Tom and Helen standing hand in hand. Gloria, beaming with pride. And dozens of colleagues, whose initial skepticism had transformed into wholehearted support. Thank you, Dr. Wilson, she said, taking the microphone. But I want to be clear about something. What we're celebrating today isn't my achievement. It belongs to every person in this room and beyond who embraced a simple truth. That healthcare at its best is a partnership between providers and patients, built on a foundation of mutual respect and genuine listening. She looked around at the assembled crowd. I particularly want to thank the patients who trusted us enough to tell us their stories, even when those stories included our failures. Without your honesty, we couldn't have identified what needed to change. In the front row, Alex gave her a thumbs up. Diane smiled at him before continuing. When I started nursing 20 years ago, a wise mentor told me something I never forgot. She said, Diane, your hands will perform procedures, but it's your ears that will make you a healer. I didn't fully understand what she meant until recently. Diane gestured to the large poster beside her, which outlined the core principles of their care initiative. These aren't revolutionary ideas. Listen actively, communicate clearly, treat the whole person, not just the diagnosis. Involve patients in their care decisions. Remember the human impact of policies and procedures. They're simple concepts, but implementing them consistently, systemically, that's been our challenge and our triumph. After the ceremony, as people mingled with refreshments, Lisa approached Diane with Alex in tow. "We wanted to give you something," Lisa said, handing over a small wrapped package. Diane unwrapped it to find a framed photograph of Alex, grinning widely in a soccer uniform, trophy in hand. "My first game back after getting better," Alex explained. "We won." "It's perfect," Diane said, genuinely touched. "I'll keep it in my office to remind me why we do what we do." "There's something else," Lisa said, her expression turning serious. "I've been thinking about going back to school. For nursing." Diane's eyebrows rose in surprise. "Really?" Lisa nodded. "After everything that happened with Alex, I realized how important good nurses are. I want to be part of that." "You'd be wonderful," Diane told her. "And if you decide to apply, I'd be happy to write you a recommendation letter." As Lisa and Alex moved on to greet Dr. Rivera, Diane felt a tap on her shoulder. She turned to find Tom and Helen. "Quite a day for you," Tom said, leaning slightly on his cane. "Big shot healthcare reformer now." Diane laughed. "Hardly. Just a nurse who got tired of seeing the same problems over and over." "Sometimes that's all it takes," Helen said. "One person saying enough." They chatted for a few minutes before Tom said, "There's something I've been meaning to ask you. The construction company I work for is bidding on the new outpatient center. The architects want input from healthcare staff on the design. That sounds like something administration would handle." Tom shook his head. "They specifically asked for people who work directly with patients. Would you be interested?" Diane considered it. "I might be. Let me know when they're meeting." As the event wound down, Diane found herself standing with Dr. Rivera and Gloria, watching the cleanup crew begin their work. "What do you think?" Gloria asked, gesturing around. "Worth all the late nights and extra meetings?" "Definitely," Diane replied without hesitation. "The real test comes now," Dr. Rivera pointed out. "Maintaining this culture as it spreads to other facilities." "That's why we built it into the system itself," Diane said. "Regular feedback loops, ongoing training, accountability metrics. It's not dependent on any one person's passion or presence." Gloria checked her watch. "Speaking of the system, some of us have a shift starting in 10 minutes. "Go," Diane urged. "I'll finish up here." After they left, Diane wandered through the quieting lobby. The poster outlining their initiative would soon be displayed in all 5 hospitals, a visible reminder of their commitment. She was about to leave when she noticed an elderly woman sitting alone, looking slightly confused. "Can I help you find something?" Diane asked, approaching her. The woman looked up. "Oh, I was here for the ceremony, but I think it's over now." "It is. Were you looking for someone in particular?" "Not really. I just wanted to see what all the fuss was about." The woman adjusted her glasses. "I was a patient here last winter. Pneumonia." "I hope your experience was a good one," Diane said, sitting down beside her. "It was, actually. Much better than when my husband was here years ago." The woman's eyes grew distant. "Back then, it felt like we were just numbers on a chart. This time, I felt like a person." "That's exactly what we've been working toward," the woman nodded. "The young nurse who took care of me, Zoe, I think her name was, she sat with me one night when I couldn't sleep. Just sat there and talked with me about my grandchildren. It meant the world." Diane smiled, remembering the young nurse she had observed with the injured child months ago. "Would you like me to help you find your way out? Or did you drive yourself?" "My son is picking me up," the woman said, patting Diane's hand. "He should be here any minute. Don't trouble yourself." "It's no trouble," Diane assured her. "That's why we're here." As they waited, chatting easily about the woman's grandchildren, and her recovery from pneumonia, Diane felt a deep sense of rightness. This moment, connecting with one person, ensuring their comfort and dignity, was the essence of everything they had built. When the woman's son arrived, Diane helped her to the car, making sure she was settled comfortably before saying goodbye. Walking back into the hospital, Diane passed the emergency department entrance. Inside, she knew her colleagues were moving through their shifts, assessing patients, administering treatments, documenting care. The work never stopped. The need never disappeared. But something had changed. There was a different energy now, a sense of purpose and connection that hadn't been there before. Not perfection. Healthcare would always be messy, challenging, sometimes heartbreaking. But a shared commitment to doing it better, to seeing the human beings behind the symptoms and diagnoses. Diane's pager buzzed. A message from Dr. Wilson. "When you have a moment, I'd like to discuss the next phase." She smiled, slipping the pager back into her pocket. There would always be a next phase, another challenge, a new opportunity to improve. That was the nature of the work. For now, though, she would take a moment to appreciate how far they had come. From that night with Alex, when everything had nearly gone terribly wrong, to today, a hospital transformed, a system reimagined, countless lives touched in ways both dramatic and subtle. As she walked toward Dr. Wilson's office, Diane passed the wall where patient thank you cards were displayed. New ones appeared regularly now, each telling a story of care that went beyond the technical aspects of medicine to touch the human heart. One card in particular caught her eye. In a child's uneven handwriting, it read simply, "Thank you for listening to my mom." Sometimes, Diane reflected, the most important changes start with the simplest actions. A moment of true attention, a willingness to hear, the courage to acknowledge when something isn't working, and most of all, the persistence to build something better, one human interaction at a time.